to this webinar on the Experimental National Weather Service HeatRisk tool. I'm Kim McMahon, National Weather Service Public Weather Services Program Manager, and I'm joined by our partners at the Center for Disease Control and Prevention, or CDC. Today, we'll provide an overview of this exciting new tool, including how it works, how it can be used, and we'll provide some verification and additional resources available to you and your partners. Today's webinar is being recorded, and by attending, you consent to the recording of your likeness. After the webinar, the recording will be available on the National Weather Service Weather Ready Nation website under their calendar and noted on the slide at the URL in the center. All lines will remain muted throughout the presentation, and we will have question and answer at the end, during which you can use the question box to ask questions. Today we're joined by National Weather Service and CDC leadership for opening remarks. I'd like to welcome the Deputy Director of the National Weather Service, Michelle Manelli.
Hello, hey everybody. Thank you so much for joining today and welcome. We are excited to be here when continuing our long-standing partnership with the CDC on this important endeavor. NOAA and CDC have a unique relationship, collaborating on several projects and initiatives over the past decade, including the co-founding of the National Integrated Heat and Health Information System in 2015, the development of CDC Heat and Health Tracker in 2020, and now in 2024, as of today, the expansion of HeatRisk across the contiguous United States. So both agencies recognize the dangers of heat. Extreme heat is the leading weather-related killer in the United States and is expected to continue increasing in frequency, intensity, and duration, with even less of that overnight relief that we often rely upon. So according to estimates from our CDC partners, heat was responsible for more than 1,220 deaths in the United States each year. So additionally, in 2023 was the warmest year on record, and the past 10 years have also been the top 10 warmest years on record as well. So compromised human health and comfort with an increased risk of respiratory illnesses, heat exhaustion, heat stroke, and heat-related mortality. This is just some of the range of the impacts that these warming temperatures have resulted in, as well as increased energy consumption needed to air-condition homes and buildings, and it leads to power grid strain, especially in areas that are not used to seeing this type of extreme heat. And these warmer temperatures and extreme heat, they do not affect people equally. For example, extreme heat disproportionately affects those living in urban areas or rural neighborhoods, as well as people experiencing homelessness and people who are pregnant, older adults, people with chronic health conditions, and low-income families. So we all play key roles in protecting the American public. So thank you for so many individuals joining us today. That just shows that we all play that role, and as partners and users of these products, you not only amplify our heat safety messaging, but you raise awareness of impending heat, and you also prepare our cities and our towns through preparedness and emergency action plans, and provide relief in the form of cooling centers and other assistance. So today we have a great webinar in store for you. You're going to be learning about our newly expanded tool for measuring and communicating the potential severity of extreme heat, our NWS HeatRisk. So this prototype was developed in the Western U.S. in 2013 and early versions, and they've been developing over time. Now with our further collaboration with the CDC, and incorporating heat health data has refined and improved this tool in the heat risk category and threshold. So excited to get more with it, and so that you learn all about our tools, and appreciate you attending. And I'm going to hand it back over to Kim.
Thanks, Michelle. Now I'll hand it over to Dr. Ari Bernstein, the Director of the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. Take it away, Ari.
Thanks so much, Kim, and great to be with you all today. Very grateful for the partnership we've had here, Michelle. It's been a wonderful working relationship, and I'm eager to continue the work that is so well represented by the subject of today's webinar, which is the heat risk. From where I sit at CDC, it is so clear how important this work is for all kinds of people. And let me take just a minute to walk you through that. I'm a pediatrician by training. I've been working on issues related to climate and child health for a long time now. And one of the key missing pieces in how we can take actions to protect lives has been knowing how hot is too hot for health. And we have had measures of that, and certainly heat risk has been in development for many years. But we're now able to, within the continental United States, give that forecast, which is so simple and easy to access and so powerful because it is directly linked to health outcomes. And so we have, confidence that when we see elevated heat risk levels, that reflects the potential for people who have to be outside for long periods of time, particularly those people who may be more sensitive to heat, to run into trouble. And that means from a health standpoint, we're now empowered to target our actions and be much more impactful when we think about how we know we can keep people out of harm's way. And so we at CDC have used heat risk as a trigger tool so that, for example, providers working with patients say, hey, when the heat risk level is red, you're someone who needs to pay attention, and here are the things we need to do. And so it really enables actions in a way that previously was not possible. It enables them, as you will hear more about, at a very local level. And I think that's incredibly empowering. And I clearly see, given my work as a pediatrician, how this how this tool could be helpful. I also want to be clear that this tool is incredibly helpful for our partners in public health because it gives preparedness. It gives us the opportunity to look forward and say, hey, we have so many resources at our disposal, we need to think carefully about how to use them, and it gives us a heads up about which events might be the ones we want to focus on in terms of risk for our communities. And so I'm really excited to see in the coming months, as it gets warmer in the United States, how these tools get used and continue to improve on them. And I think I want to underscore how great the collaboration has been with the National Weather Service and NOAA on this, and how we will continue that partnership to protect health and improve lives moving forward. So I'm delighted to be here and looking forward to the webinar. I'll turn it back to Kim.
Thank you. So now allow me to introduce our subject matter experts who will be speaking today. Mike Staudenmaier is the Division Chief of the Science and Technology Infusion Division of Western Region. He has over 30 years in the National Weather Service, starting at WFO Sacramento in 1993, then working his way up through several Western Region offices, including as the Science and Operations Officer at the local forecast office in Flagstaff, and the meteorologist in charge at the local office in Las Vegas. He joined Western Region headquarters in 2012 as the Regional Deputy Science Chief before taking on his current role in 2019. Mike and his team developed the initial approach to heat risk in 2013, and he continues to lead the development effort with this latest release. Dr. Rish Vaidyanathan is a senior health scientist with the Climate and Health Program at the National Center for Environmental Health, CDC, and has been with CDC since 2004. Rish's training and work experience cover a wide range of substantive areas, including epidemiology, exposure assessment, and data science. In addition, he has been able to establish mutually beneficial collaborations with various academic institutions, state and local health departments, and federal agencies on efforts to identify and characterize populations most at risk to heat exposure and other climate-sensitive exposures. I'm Kim McMahon, the National Weather Service Public Weather Services Program Manager at Weather Service Headquarters, and I oversee the policies, procedures, and guidelines for weather hazards such as extreme temperatures, wind, frost freeze, dust, air quality, and more. I'm a co-lead of the National Integrated Heat Health Information System, also known as NIHIS, which was founded by NOAA and CDC to coordinate and collaborate on research, initiatives, and messaging regarding heat and heat health across federal agencies. Extreme heat kills more so than any other weather-related hazard. Top 10 warmest years on record occurred in the last decade, and it isn't getting any better. Today, we're introducing a new tool that combines temperature and health data to better signal potential health-related impacts due to forecast heat. This tool is the result of a long-standing collaboration between CDC and the National Weather Service. Our two agencies work together to identify temperature thresholds and develop a service that contextualizes heat forecasts with data and methods that are relevant from a public health perspective. The Weather Service integrated health-based temperature thresholds provided by the CDC with local temperature parameters to devise heat risk. HeatRisk is the first multi-tiered framework that applies a consistent approach across different climate regions, incorporates high-resolution climatology and locally relevant health evidence, and provides decision makers with a heat service that is easy to use and yet appropriate from a public health standpoint. I want to state that no one is immune to the effects of heat, and there are several groups of people who are at higher risk. Some of these groups include children and older adults, pregnant people, people with disabilities or chronic health conditions, those who work outdoors, including first responders, or those with a degree of social vulnerability who may be unhoused or lack the resources to properly cool their homes. It's important to not forget pets and other animals during extreme heat events, as they can also be impacted. While we will focus on heat risk in this presentation, I just want to remind everyone that heat risk is another tool in the toolbox of the National Weather Service forecast to assess and message the forecasted heat. Heat risk is a color and number-based framework that compares forecast temperatures against scientifically derived thresholds to provide an index of the potential risk for heat-related impacts. Think of analogies like the air quality index or UV index that express complicated information in an easy-to-understand color and number approach with excellent geographic coverage. The science underneath heat risk provides a nationally consistent approach to provide a robust and always available heat service through the 7-day forecast period. Heat risk was developed to also include specific information for heat-vulnerable groups, which typically experience impacts at thresholds below climatologically extreme temperatures. Because heat risk is a framework, the science used in the approach can continue to be improved over time without fundamentally changing the messaging framework of the colors and numbers and appropriate actions to take at those levels. I also want to note that heat risk is currently an experimental product, which means that it's not supported 24/7 and changes may occur without advance notice. It's important to mention some of the basic tenets that form the backbone of heat risk approach. Research has shown that communities adapt and build to their local climatology, and it is possible for people to acclimate on a timescale of a week or two to a point. Research has also shown that some level of heat can be physically dangerous to the human body no matter the time of year. But it also suggests that everyone has different heat tolerances, so this means a single threshold would not work for everyone. We use the 95th percentile of temperatures to identify heat episodes that are excessive for a particular location. This is a method used in many studies in heat health warning systems around the world. Temperature is the first order driver for heat impacts, and other items like wind, humidity, clouds are secondary drivers. They're important, but at the base level, temperatures drive heat impacts. Humidity and air mass characteristics can be roughly estimated by temperature ranges and minimum temperatures. In order to be consistent across the contiguous US, or CONUS, the same framework rules need to be applied in a similar fashion to all locations. Here you can see all the factors that are considered in the heat risk approach. The big differences from traditional approaches are that both high and low temperature play a role in predicting the 24-hour value. The thresholds identifying the various levels of heat stress change throughout the year based on local climatology to better account for acclimation. The entire 7-day period is examined to identify periods where excessive temperatures exist for 2 or more days. And for the first time in the national graded approach to heat, CDC heat health thresholds are used to inform what temperature values are dangerous to humans. There's a lot of complex science that goes into this, and it's okay if viewers don't understand all of the deep details. We intend to make sure that the concept and process are boiled down so you get a general but good understanding of heat risk. And now I'll pass it over to my colleague, Rish.
Thank you, Kim. So when CDC started this collaboration with National Weather Service in 2016 on this specific effort, I should note that around this time there were few efforts aimed at refining temperature thresholds used for watches, warnings, and advisories. And these efforts, successful collaborations between health departments and local weather offices, looked at, at what point, at what temperatures alerts were issued and compared them against, where the health risks were at that particular point. And we conducted a similar assessment in collaboration with National Weather Service and our partners. And some of the findings from this multi-state assessment helped us understand how health risk and burden vary over a range of temperatures. And it also helped us whether alerts issued during the summer months were effective in preventing a major proportion of heat-related health impacts. In addition, this effort gave us a sense of how some of these epidemiologic methods used in the analysis could be expanded to calibrate alert thresholds. And specifically for this collaboration on heat risk, we focused on ways to bring health data, especially CDC-based data assets, and also to develop a process that can leverage local heat health relationships, or first generate and then leverage those relationships for calibrating alert thresholds. Of note, both CDC and National Weather Service wanted to have an alert framework, that accounted for first, the temperature ranges that are most sensitive for predicting health burden. So I know we've heard how the temperatures associated with health occur over a range of temperatures. So factor that. And then we also wanted to make sure we're accounting for early season impacts, acclimation, and also warning fatigue. And essentially, our overarching goal when it came to including health data was to make sure the heat forecasting tool is suitable for public health purposes. So the local health information that we wanted to include in heat risk wasn't readily available. So we had to make some decisions on data and analytic approaches for generating these heat health relationships. And we decided to go with mortality data as they were available to CDC, and the daily data we needed for this analysis were available at a county scale. And once we identified a data source, it was important to identify health outcomes that result from heat exposure. And as you know, as many of you know, there are a couple of different approaches to conduct an epidemiologic analysis for understanding the heat-related health impacts. The first method, as you know, is using the information that's directly reported on death certificates. And health data organizations take, information reported in a death certificate and transcribe them into a set of codes. And these codes are then used to identify whether heat exposure was the underlying or a contributing factor. So on the screen, you're seeing a copy of a standard certificate of death. So in there, you have these underlying cause, immediate cause, and the contributing causes listed. And these are usually text fields that some might indicate heat exposure, some may not. So if there isn't a way for the people who are transcribing the information to understand heat was reported on the death certificate, it wouldn't make it into the death record. So the fact that that death was not resulting from heat will not be apparent from the death certificate. And also deriving heat health impact information using this code-based approach and might fail to capture the full spectrum of impacts associated with heat exposure. And the second approach we considered uses a statistical framework to ascertain deaths resulting from heat exposure. So usually we develop a relationship between deaths and a measure of temperature, like max temperature or minimum temperature. And that is modeled using a statistical approach, that relationship. And then once we have the heat mortality relationship developed. That's what you see on the screen, where the blue curve denotes risk at varying temperatures. And you look at the red dot, and that's basically the point at which the risk starts to increase. And the curve on the screen, if you look at the change in mortality, you could see that it's not a linear increase. So after a point, you could see some nonlinearity in that relationship. And using these heat mortality relationships, we can compute heat attributable burden or excess deaths. People use these terms interchangeably at various temperature ranges. And there's a lot of complex modeling and data wrangling that we did to generate these heat health relationships, but I'll give you a basic summary. For the data sources, we use mortality data from CDC's National Vital Statistics System. Weather data came from National Weather Service. And not to go into the specifics of the epidemiologic methods, but we used state-of-the-art methods in heat epidemiology. And these methods have been developed by Professor Antonio Gasparini and his colleagues, and widely used to understand relationships between environmental exposures and negative health outcomes. The modeling itself is done in two stages. First stage is a time series analysis at the county level, and we created these heat mortality relationships based on both Tmin and Tmax. In addition to heat exposure, we control for air pollution measures, specifically fine particulate matter or PM2.5 and ozone. And we also controlled for seasonality, long-term trends, day of the week, and other important predictors. Lastly, when we generated these heat mortality relationships, they were estimated for a cumulative lag period of 3 days. And we did this because we know that several studies have reported delayed effects of heat exposure. And we wanted to make sure that we're capturing the impact of a particular day in terms of heat exposure on subsequent days, especially when it came to accounting for mortality increases. And the second stage of our analytical framework was needed to basically we used a meta-regression, a multivariate random effects meta-analysis. So we did this basically to account for any stability issues, especially in areas that are affected by small sample size. And then think of the second stage modeling as a way to smooth out imprecise heat mortality relationships due to sparseness of data. And this is an example of a heat mortality relationship, and we did create a heat mortality relationship for every county in the data set. So the y-axis denotes health risks. The x-axis denotes temperature. The area left of the blue vertical line is what we would call a no-risk zone, or the effect of heat exposure is not observed. And then the area right of the blue line is the heat-sensitive zone. And the point where the risk increases, so that's the minimum, the yellow point is the minimum mortality temperature. So just based on construct, this is the point at which the effect of cold stops and the effect of heat starts to increase. And the magenta dot is meant to denote an exceptionally high risk point, often associated with extremely high temperatures. And it is fairly straightforward to identify temperature values associated with the lowest risk and the values associated with extreme risk, because they usually coincide with a climate extreme. But the challenge for the purposes of setting thresholds for heat risk was to identify cut points between these yellow and magenta dots. Here's an example of the heat mortality relationship for warmer and cooler climates. And they're usually a J-shaped or a U-shaped curve. And for example, if you look at a warmer climate, you tend to see the shape is pretty much the same as what you would see in a cooler climate. But you look at what happens to the risk, it's increasing after a point. And then also keep in mind that the number of days, for example, days with temperature at or about 100 degrees Fahrenheit are fairly common in a place like Phoenix. But however, in a place like Flagstaff, which is still in the same state, those temperatures are fairly rare. So just using these risk increases or risk profiles may not, help us capture that health impact that we're after for this setting an alert threshold. So, what to consider here is we should look at underlying heat exposure patterns, which sort of like tell us what the % days of exposure for under each of these scenarios were. And if you look at in this slide, like we're actually illustrating heat attributable deaths, which is a measure of health impact, and for both a warmer and a cooler climate. So essentially, you take the risk information and then combine that with % days of exposure, and you get heat attributable deaths, simplistically put. So in warmer climate, we see heat attributable deaths increase with temperatures, and in cooler climates, we typically see the opposite pattern where moderately hot temperatures account for a lot more impact compared to extremely hot temperatures. And understanding mortality patterns over a range of temperatures is necessary to tailor risk thresholds that correspond with public health impacts. And up to this point, all the decisions we made were in terms of selecting a data source, analytical framework, spatial scale for conducting this analysis, and generating measures of health impacts. Essentially, these are basically decisions on how to conduct an epidemiologic analysis or a temperature-sensitive health impact assessment. So the next step was to translate the epidemiologic evidence into an actionable measure that could be used for understanding mortality impacts by temperature, as well as knowing specific ranges within that distribution that correspond with major health impact thresholds. And we came up with this measure, like FAD or PHAD. We haven't quite decided how we say that, but it's the % of heat attributable deaths. So, which is a proportion of heat attributable deaths at a specific temperature, considering all heat attributable deaths occurring in that county, again expressed as a percentage. And here's an explicit table that was generated with PHAD values for multiple locations. I think you can see, the temperature-sensitive ranges, could vary pretty much anywhere. For example, in Alabama, you're seeing anywhere between 83 to all the way to over 100. So within that temperature distribution, we want to actually look at what's the % contribution of each of those temperature ranges. And then once we had this distribution of PHAD values for multiple locations, we could determine cumulative mortality impacts associated with a typical summertime temperature distribution. And in summary, the county-specific heat mortality relationships and the PHAD values were instrumental in determining health-based thresholds associated with various heat risk categories. And now over to Mike on how the thresholds were set for heat risk.
All right, thanks, Rish. All right, so let's talk a bit about these 5 heat risk categories. The worst category is the extreme level, and we color that magenta, and it's numbered level 4. This category accounts for rare, long duration, and extreme heat waves that will have the greatest impact throughout our communities, including an extreme risk of heat-related deaths and illness. These events will stress local infrastructure and resources to adequately respond. Overnight lows will remain excessively high relative to that climate, in addition to daytime temperatures. The next category is the major level, colored red, and numbered level 3. These will also be highly impactful events with a major risk of widespread heat-related impacts, including illness and mortality, but the duration or intensity may be just a little bit less than a magenta event. Both magenta and red level events represent something in the top 5% of hottest days and nights in the climatological reference period for that location. It's important to note that at these levels, the at higher risk populations will still be disproportionately affected by this heat, but this level of heat will also affect the majority of the general population who do not take proper precautions. Moving down the scale, moderate is colored orange and numbered level 2. For most people, this will be uncomfortable heat, with the at higher risk populations likely experiencing the majority of significant impacts. It's important to keep in mind that orange values of heat risk still mean that some heat-related impacts are to be expected, especially during the heat of the day. Additionally, it's important to note that otherwise heat-tolerant individuals can become one of those at higher risk populations when they do not adequately hydrate or stay cool during the heat of the day. Additionally, it's important to note that otherwise heat-tolerant individuals can become one of the at higher risk populations, as we said, when they don't take the proper precautions. And some examples of that are when they're attending an outdoor venue, when they're participating in strenuous activities outdoors, again, without taking proper precautions. The minor category, colored yellow and numbered level 1, is the lowest level of elevated heat risk and likely to impact only the most exposed and heat-intolerant individuals or systems. Green levels of heat risk, or base level 0, represent expectations of little to no elevated heat risk with few to no heat-related impacts. All right, so let's walk through an actual example showing how the heat risk thresholds are put together. We'll walk this through the process of generating the point thresholds for maximum temperature for a location that we'll call Your Town, USA, by generating an annual plot of these daily threshold values. So here we've plotted calendar days along the bottom x-axis and temperature in degrees Fahrenheit on the vertical y-axis. The official 1991 to 2020 normal daily max temperatures are shown by the dark curve. The daily records using the station's period of record through 2020 are represented by the dots. The thin gray line is a smooth 95th percentile curve using the daily range of temperatures experienced at this location during a fixed period of 1970 to 2020. This identifies those top 5% of temperatures throughout the year. So now we'll determine the yellow or the minor threshold. So where did this come from? As you heard, we partnered with the CDC to determine what's the lowest temperature that people start to die from heat, obviously the worst impact that there is out there. For urban areas, we use the minimum mortality temperature, which was discussed earlier. For non-urban areas, where populations have been shown to be a bit more resilient to weather extremes, we leverage the first percentile values to provide a slightly higher starting point. So in plain English, this yellow threshold really means that this is the lowest temperature that essentially any heat-related deaths were modeled to occur. Anything above it presents some level of danger regarding heat. Anything below falls into the green or none category. In this example, the yellow or minor threshold is 70 degrees. Note that we keep this minimum threshold value the same throughout the year. So here's what the yellow minor threshold looks like when you take all the various point values that we use in the approach and distribute them on a 2.5 kilometer resolution grid across the entire contiguous United States. You'll see there's quite a lot of variability. In hotter locations at more southern latitudes, the values in the upper 70s to lower 80s. In the north or at elevation, the values are much cooler, down into the mid-60s. So how do we map these values across the country? Through our partnership with the CDC, we generated these threshold values across the country where high-quality data existed. Those are the little circles that you see plotted on here. We then interpolated those data onto climatology grids at the CONA scale to get continuous data at 2.5 kilometer resolution. All right, so back to our example. So we now define the red or major level. This is done again using data in partnership with the CDC. If you look at the shoulders of the red annual curve, you'll notice they're flat. This is the base temperature threshold for the red level, which is derived from the 50th percentile of CDC's heat attributable deaths for that location. Thus, half the heat deaths were modeled to occur with temperatures at or above this threshold. This also means that half of the heat deaths would be modeled to occur at cooler temperatures than this threshold. To account for acclimation, we then increase the red threshold level where it intersects the 95th percentile of temperatures at this location. Where that intersection occurs, the red threshold will then follow the 95th percentile curve. Those stair steps follow a similar pattern to the annual increase of normal temperatures in the spring, along with a commensurate decrease in the fall, supporting the research that suggests that non-heat sensitive populations generally acclimate over a 5-day to 2-week period of time to increasing temperatures. It's important to note that they also deacclimate to heat over the same time period, so sudden spikes in temperature in the fall have been shown to result in spikes in heat impacts even after a hot summer if the fall heat wave was preceded by a sufficient duration of cooler temperatures. So now that we've defined our yellow and red thresholds, all that's left is the orange threshold. This is the level that's focused on being of most benefit to those heat vulnerable populations and sectors. These groups have lower heat tolerances overall, including lower acclimation potential. So to account for these factors, we apply a few different approaches. Overall, orange thresholds are some intermediate of the red, yellow, and normal values. In the spring part of the heat season, the orange thresholds are a bit lower than they would be in the fall to account for the higher susceptibility of the population after the long winter months. To determine a higher fall threshold value, we leverage a CDC-derived value associated with the 25th percentile of heat-associated deaths. Acclimation is also accounted for with a different formulation of the orange threshold stair steps in the spring and the fall to provide lower values in the spring than they are in the fall. You'll also see that when applicable, the orange threshold is capped at the red shoulder value, which accounts for that lower acclimation overall that those at greater risk populations have. But it also stays true to that CDC 50th percentile mortality value that likely includes a large majority of these at greater risk populations. We know it all sounds pretty complicated, but there is a lot of heat health science that we're attempting to consider in this approach. So at this point, we've now defined all of our daily thresholds for our example location. As this example chart shows, on any given day, this location has unique daily thresholds for yellow, orange, and red, which can then be used to put the forecast temperatures into heat-related context. We follow a somewhat similar approach for minimum temperatures, leveraging CDC data for the yellow threshold again, but we solely leverage climatological data for the orange and red thresholds. This is for two reasons. The first is because the CDC did not find as strong a relationship between their health data and minimum temperature independent of maximum temperature for us to use their model thresholds exclusively. So we use the minimum temperature to identify those situations where climatologically unusual overnight heat contributes to maintaining or even increase the heat stress that accumulated during the daytime period. Or, if cooler minimum temperatures, that would lower the risk. The second reason we include minimum temperatures in the approach is because we can leverage the general correlation between elevated humidity and elevated minimum temperatures, which is a core concept of Meteorology 101. We leverage this relationship in a few different places in the approach. One area we do this is by lowering the red spring and fall shoulder values for min temperature in more humid climates, and we raise them in more arid climates to, again, better account for the role of humidity. So we carry this process out to calculate the maximum and minimum temperature thresholds at about 3,100 individual stations across the country that have high-quality climate data which have passed our QC process. We then use high-resolution climatology grids with this point data to develop daily gridded red, orange, and yellow threshold values across the entire continental United States. This approach, which we know is complicated due to the amount of heat health science going into it, leads to very different annual threshold curves at each location. Here you can see an example for both Washington Reagan Airport and for downtown Los Angeles, showing how these thresholds increase during the spring, they peak, and then they drop during the fall. But the values and even the curve shapes themselves are very different throughout the year in order to represent that climatology appropriately. We know humidity plays an important, though secondary role in heat impacts, especially across the eastern United States. In fact, there is strong evidence to support the 100th meridian as a natural divide between the humid east and the arid west, as shown in vegetation and rainfall. This is also true for the peak average dew point, shown here contoured at 50, 60, and 70 degrees Fahrenheit. So there's compelling evidence to support making different moisture adjustments within the heat risk algorithm for locations east and west of this divide. So that's just what we do by splitting the country up into either a humid east or a more arid west. So let's talk about how we create the overall 24-hour value of heat risk, which is the final output of the approach. First, we assign a 0, 1, 2, or 3 to each individual maximum and minimum temperature forecast value based on where they fall within those daily red, orange, and yellow thresholds for that location. We then combine those values coming from the morning min temperature, the afternoon max temperature, and the following morning's min temperature to create the 24-hour value. Here's where we utilize that natural separation between the humid east and the more arid west. When we create the overall 24-hour values of heat risk, we leverage differing contribution weights from the three inputs to help better approximate the role of humidity. For humid climates where humidity plays a significant role in modifying the actual temperatures, The combination involves having the minimum temperatures on either side of the afternoon high, providing 55% of the 24-hour value. The contribution from the afternoon high itself accounts for the other 45%. In dry climates, the impact of heat stress from the afternoon temperatures is generally much more substantial than that from humidity. Therefore, the contribution from the maximum temperature gets the greater weight, in this case 67% of the overall 24-hour value. The minimum temperatures provide the other 33%. All right, so stepping back, here's a look at the full process. You now should have a pretty good understanding at this point of the broad strokes of what heat risk is and how it works. One last thing I'll point out, though, is how do we get to that magenta or extreme risk category? We can hit magenta in two different ways. The most common are those situations where we have 2 or more consecutive days of very intense heat, meaning the values for both the high and low temperatures on both days are above the 95th percentile or within that red or major category. In other words, the location is experiencing the upper 5% of warmest days and nights over a 48-hour or longer period. The second, less common way are those situations where the location is approaching an all-time record temperature that's at dangerous levels. When either of those conditions occur, the extreme category will kick in. Since heat risk was initially developed in the West, people always ask me, so how does heat risk verify everywhere else? As we discussed, heat risk was developed using mortality data thresholds. So with heat risk going CONUS-wide, we wanted to test the approach using independent data over 5 full heat seasons to generate some long-term verification. So we examined CDC-provided emergency department heat-related injury data, which in this example is expressed as a rate per 100,000 emergency department visits. These data are organized into 10 regions across the continental United States based on FEMA and HHS regions. For each of the regions, these daily heat injury data counts were compared to the daily average observed heat risk values using all of our approved NCEI points in each region for the full heat seasons spanning from April through October for the years 2019 through 2023. You can see that each region has its own chart plotting the data, including the logarithmic correlation. Region 10 is shown in the upper left, and Region 1 is in the upper right. The center map shows the date with the highest impact rate during the entire period, which was on June 28, 2021, when the Pacific Northwest suffered from an historical and devastating heat wave, and the Northeast United States had a significant heat wave concurrently. So what were the results? I know you can't see the scores here, so I'll walk you through a little bit of it. We in the weather and climate world generally get pretty excited when we see correlation scores above 0.6. These 5-year correlations between heat risk and the injury data set across all regions were well above that, with the lowest correlation score being 0.80 in Region 1 and the highest correlation score being 0.90 in Region 6. This is a great indicator of the utility of heat risk, not just for the big warning days, but for all those other times when less widespread but still important heat-related impacts are happening. Is it perfect? No. But this independent data set does show that heat risk did quite well over a 5-year period across the entire country, not just in the western United States, in identifying those bigger events in each region. It also shows that even without directly utilizing heat index, it provides a skillful means to identify the days when many people were going to the emergency room for heat-related injuries from the other less impactful days. The CDC conducted its own independent analysis of point-based heat risk output in 2023 against a population-weighted data set of emergency department heat-related injury data, again based across the same 10 FEMA HHS regions. Independently, their analyses showed that for 2023, heat risk was skillful in identifying the general trend of emergency department heat-related visits increasing with increasing values of heat risk. Their Spearman's rank order correlations were between 0.77 and 0.93, again, really impressive values. The CDC and the National Weather Service are continuing to conduct additional assessments based on other more local or regional data sources. Working with the National Weather Service local offices, heat risk can also be compared to robust local heat impact data sets. We feel it's best to have this validation done through a probabilistic distribution of impacts rather than just against a single threshold. That way, however the impact data correlates, that information can be used in the future by the decision maker to make more informed decisions based on future forecasts of heat risk. This example was conducted by the Maricopa County Department of Public Health in Arizona. Just for reference, Maricopa County is where the majority of the Phoenix metro area resides. So this is a very hot climate, yet they're finding significant heat health impacts occur every year. On the left side, you can see a plot of daily heat risk categories colored by heat risk level at the Sky Harbor International Airport, with the lengths of the bars related to the daily count of heat-related deaths, showing a strong relationship between daily values of heat risk and the number of heat-related deaths. In the upper right corner, you can see a table showing the percentage of heat-related deaths which occurred under each category of heat risk, 67% of which occurred at red or magenta levels. But you can also see that 31% of the heat-related deaths occurred in the yellow and orange categories, showing the wide range of temperatures where heat-related impacts can occur, even in what we would call a hot climate. This doesn't mean a heat risk doesn't work here, but it does suggest that heat-related impacts, while driven by temperatures, are intertwined with many complex human and societal factors leading to complicated results at times. There's no one threshold that captures all of these impacts. But knowing that 67% of those impacts have occurred in red and magenta categories of heat risk provides the decision maker with powerful information for making more informed decisions in future forecasts of heat risk. So now I'll hand it over to Kim, who's going to talk about a few other things.
Thanks, Mike. So the Weather Service has a CONUS viewer for heat risk on the Weather Prediction Center webpage. This is an interactive webpage that provides a way for you and your partners to look at the live heat risk data. As the animation shows, you can move through the 7-day heat risk forecast and click on a location to get the forecast temperatures and heat risk categories. You'll also find KML and GeoTIFF layers and further information to better understand heat risk, including appropriate actions to recommend for each category. Additionally, by the end of May, heat risk grids will be available for all of the CONUS on the National Weather Service National Digital Forecast Database, or NDFD. Through the NDFD, heat risk will be available in gridded binary data edition 2, or GRIB2, XML, and web map services. In the West, where heat risk has been available for almost 10 years, partners are using it more and more. Some states, like California, are leveraging heat risk in their decision processes, including putting up KML files of daily heat risk on their internal dashboard. And you can see on the top left, media partners are using heat risk in their broadcast and social media channels. Health partners are including it in their own briefings and distribution lists, seen on the top center from Marin County, California. Heat risk is also used in planning documents like these examples on the right from Maricopa County's Hazard Mitigation Plan and the California Governor's Office of Emergency Services. And schools are using it to inform their decisions on outdoor activities. The simple color number system, along with the lack of any geopolitical borders, have been identified as big reasons for its adoption by a myriad of partners and decision makers. On the CDC side, there's a mobile-friendly dashboard that equips the public with access to the heat risk forecast and the information they need to better protect themselves when outdoor temperatures may be higher than normal and could impact their health. In addition, you'll see 2 blue buttons on the bottom, and these links provide more information for healthcare providers and the general public. The link to the CDC dashboard is provided below. It's www.cdc.gov/heatrisk. Very briefly, users can look up their heat risk and the air quality index, or AQI, this information by zip code. Along with the prevailing heat risk and AQI levels, prevention messages will be displayed on the dashboard, and these messages are tailored to the category of heat risk and AQI. Here are examples of heat prevention messages and actions that one can take to protect against heat exposure at different heat risk categories. And these actions can vary depending on the heat risk level. Lastly, these actions are based on whether someone is staying indoors or staying outside. Heat risk has many advantages, but it is not the only tool in the toolbox. Heat index and wet bulb flow temperature are still used by our partners, decision makers, and the general public to varying degrees, and there's no silver bullet for heat. All of these tools should help inform how to prepare for heat based on user needs. Each of these tools plays an important role in communicating heat, as do maximum and minimum temperatures. And you can go to weather.gov/heatrisk heat index, you see an overview of the 3 tools mentioned in the last slide, including material and resources such as reference sheets. And through September 30th, 2024, you will be able to submit feedback on HeatRisk at the URL listed at the bottom of the screen, or by visiting the WPC HeatRisk CONUS viewer and clicking on Comments, Questions, Please Contact Us at the bottom of the screen. So thank you for attending today's webinar, and now we'll take some questions. So please use the question box to input your questions, and if you're unfamiliar with this interface, you can find the question box in the toolbar. So you may need to click the white arrow in the orange rectangle to make the toolbar visible. Thank you.
Okay, thanks, Kim and Mike and Rish. Great presentation. A lot of information there. We're getting a lot of fantastic questions. Let's start off with one here. Let's see. Allison asked, does the 95th percentile of unusual change over time as the climate changes? We had another similar question about the period of record that's being used as a basis for what is termed unusual. Mike, can you comment on that, or Rish?
Yeah, so 95th percentile usage is pretty common in other heat alert systems across the world when we're doing our peer review literature searches back in the 2013 time period. The way that HeatRisk is set up is every 5 years we recalculate the 95th percentile to account for the warming climate in most locations, and that allows the HeatRisk thresholds to change as the weather changes, essentially from that. And then every 10 years we would update the NCEI climate normals for those locations as well.
Okay, thanks, Mike, for that answer. Another question that we had here, and this one can go to either Rish or you, was asking how was the warm season determined? They're asking CDC tracking typically uses May to September and not April through October, so they were wondering about the difference there. So if either of you want to grab that question.
Yeah, from our point of view, from in the West, heat season in California, where this was originally generated, Santa Ana events typically happen in September and October, so we needed to expand the heat in that period of time. And also in Phoenix and in the far south, you already can start to get excessive heat into that yellow and orange category in March. And so we thought that the March to October timeframe captured more of the heat that we were looking for.
Oh, sorry. This might be a question for Rish. Can state health departments get access to the temperature threshold number used by counties or other geographic breakdown like census tract? Can you comment on the availability of data that some people might want to get some of this core data that was used?
Yeah, sure. I think we're planning to draft this up as a report, and all the information is available. And also in terms of census tract level, I don't think we did the modeling at the census tract level. I don't think we had data at the census tract level. But what was your last question, Gail? Sorry.
Yeah, just getting access to some of the threshold numbers and some of the thresholds that were, that may be a question for Mike as well. Getting access to some of the core data that was used.
Yeah, sure. I think we have a website which will give us that information, and I could drop that link in the chat. So right now, if you go to that link, you will have a lot of information about those thresholds where the health-based thresholds start and where you see the profile for the 95th percentile.
Yeah, Gail, we recommend that anyone who's interested in that should reach out to their local weather service office. We feel that the threshold, that we're working on a way to make the threshold data available a little bit more interactively, but at this point, helping to walk people through how to interpret the data is pretty important. But at each of these points, we have point-based data, essentially, that has those thresholds in the way that I formulated it when we were walking through how we created the red, yellow, and orange categories. Those kind of charts exist at each one of these points.
All right. Somebody here had a question. They were asking about the difference between the rural and urban area determinations. And they said they just missed what the first percentile value was that was used to calculate that. So Mike, if you want to answer that real quick for them.
Sure. As Rish described in the modeling, from that minimum mortality temperature up to the hottest value in that city-county pair for temperatures, there's a distribution of temperatures and heat-related impacts there. Instead of using the minimum mortality temperature for rural locations, we use the first percentile rather than the 0th percentile, essentially. So just a little bit higher.
Thanks, Mike. So a lot of questions coming in. Can you reiterate again the historical heat risk information? Several folks are asking about past data for heat risk. Would you mind touching on that real quick?
Sure. Yeah. Again, this is a partnership that we would want external users to be reaching out to their forecast offices. That the forecast office can work with people either to just gain access to those data, or to actually help them interpret the information that's on the resources that we have available.
Okay, this one I think is more for Rish. And there's a question here: are there any studies that have focused on days when poor air quality has compounded the health risk during days with excessive heat?
Yeah, there are studies that have looked at both wildfires, for example, wildfire smoke and heat. I mean, more studies, I haven't seen a whole lot of studies, but definitely there are a few studies, especially from California, that have looked at both heat and air quality, or poor air quality, especially from wildfire smoke.
Well, again, a lot of good questions coming in here. Any thoughts on how heat risk information may inform occupational heat illness regulation, development, or enforcement? I think this gets a little maybe out of your wheelhouse, but probably something worth addressing anyway.
I'll answer that. So OSHA is the official federal agency that oversees regulations when it comes to occupational safety and health. So they can certainly look into our tool. The CDC and Weather Service do not have any regulations when it comes to occupational safety.
All right, thanks for that answer, Kim. So here's one that came in. It's asking, can you download heat risk data directly from the tool, or would that be something where you would need to go through your local weather office?
Okay. So in one of the slides that I showed earlier, you can go directly to the WPC page, which I also put in the chat, and download the KMLs and geotips directly.
All right, thanks, Kim. How are you planning to communicate this to the public, particularly vulnerable communities? Is there a plan to reach out directly to communities or individuals, or communicate primarily through meteorologists and the website?
So we actually have 122 local weather forecast offices and even more other offices that are in communities and work with their local public health officials, emergency managers, even some faith-based organizations, Red Cross, and other community-based organizations. So while this tool is being introduced, those offices are going and working with their local partners to help them gain an understanding and help evaluate, because as I said earlier, we do have a public comment period. So while everyone is becoming familiar with this particular tool, we strongly suggest that our partners do provide their feedback, and that will allow us to make the tool even better if we need to.
Okay, I think this is a good question for Mike. So should heat risk be used for developing guidance for outdoor workers, sports activities, for school guidance, or is the wet bulb globe temperature tool better? Can you share more on when to use which tool for those at risk for exertional heat illness impacts?
So I'll take that one, Phil. So again, for any sort of regulations, especially for the occupational safety, we would defer to OSHA. But I will note that we do have 3 tools specifically because heat is complex and each tool should be utilized to communicate to the appropriate audience. Heat impacts depend on your personal health, your exposure level, the rigorous activity that you may be doing or not doing. So heat index, for example, we utilize that to communicate heat stress in context for the general public, because most of the general public that we deal with every day understands the concept that if you have temperature and you add high humidity, that makes it feel more oppressive. Wet bulb glow temperature was developed in the 1950s by the U.S. military specifically for healthy individuals doing rigorous outdoor activities. So that's not exactly something you want to use for more vulnerable groups per se, such as the pregnant people or older adults or children. Heat risk, the benefit of that is it provides context of how abnormally hot it is, but it also takes into account that CDC heat health information data and has messaging, if you go to the website that we noted in the chat, for the more vulnerable population, especially at the yellow and orange categories.
Awesome, thanks, Kim. This is a good question to maybe reiterate. Rick asked, does temperature include both wet bulb temp and normal temps? I guess, Mike, could you reiterate again the role of humidity and why that was not specifically taken into account?
Sure, Gail, thanks. Yeah, so again, when we started in 2013, we were looking at approaches to move forward with, and when you started looking at the data sets for temperature, there aren't many stations that report dew point temperature with a 30 to 50 year period of record, which we need to derive a good, useful 95th percentile approach. And so we wanted to have a lot of data points across the country spanning rurals, airports, cities, middle of nowhere. And so using co-op stations that do not report, dew points so that we could calculate apparent temperature just wasn't feasible at that point. And there's no climatology grids for heat index that we could put those points in and create a 2.5 kilometer grid with as well. So there were several reasons that kept us away from using this kind of an approach with heat index.
Okay, thanks, Mike. I'll have this for Kim. So the question is, will we have the capability to use this tool on the air at some point down the line? I know we use the air quality index scale on TV, so I thought I would ask for this one.
Well, I think we mentioned it earlier, some of the offices or broadcast meteorologists in Western region where it's been available for about 10 years are using it on the air. I believe they are downloading the KML files, and that is how they're able to show it on their broadcast. But I will say that the expansion from Western region to the rest of the CONUS is brand new, so we encourage everyone to take a look at it and evaluate it and see how you can use it in your messaging, but also mostly provide us feedback, because we certainly want to know how you're using this service, how it could potentially be improved, and how your users are responding to it.
Getting some questions about recalibration and improvement. As good as the correlations are, have you looked at recalibrating your thresholds based on what you've learned from studies, observations to improve correlations further? How frequently will the product be issued, updated? So it's kind of a two-part question.
So Mike, if you want to touch upon the, the calibration, because I think that's leading to what you mentioned earlier of the amount of work spent to incorporate the minimum temperatures and the differences between arid and moist climates.
Yeah, it's a non-trivial effort to recalibrate, because we'd have to start with the CDC data, obviously, and then work our way up with those new relationships and recalibrate it. But that's something that's on the list to do down the road as we learn more about the tool and how well it performs, and when we look at other data sets and see how well it performs. We're pretty happy with the correlation scores the way that they're coming out right now. So I think right now, we're just going to test it out this year and see how well it works, and then think about it down the road.
And Gail, I may have missed the second part of your question.
How frequently will the product be issued or updated? Maybe looking at the actual product when people are looking at it and what it's based on.
Yeah, so the forecast itself is updated every day, multiple times every day, and it goes out through 7 days. So it's always incorporating the latest temperature forecast that the National Weather Service is predicting, and then comparing it to those threshold values. And as I mentioned with a previous question, the goal is that we would account for the changing climate by looking at those temperature thresholds in terms of the 95th percentile and re-deriving those, along with incorporating the new 30-year normals as they come out every decade.
All right, thanks, Mike. This one I think is going to go for Mike and Rish both. It's an interesting question. It says, have you taken a closer look at spatial correlations and relationships related to very localized factors, such as urban heat islands, green spaces, etc.?
Yeah, I can start, Mike. And then, so I guess so we're limited by the resolution at which we got the health data. So, it's at the county level, then related to the weather station that was contributing information to that county. So we do have, variability, sort of even I was giving you an example between Flagstaff and Phoenix. So we can even look at a much closer county and how those things vary, and we could sort of look at what's probably the pattern in an urban area versus a rural area. But sort of driving down to the reason why those differences occur might be a bit difficult with the granularity of the health data that we have.
Yeah, I think the benefit of the 2.5 kilometer climatology that we're using offers, a little bit of help in terms of distributing these finite point data, in the sense that if we think about a heat wave, it typically happens under a large sprawling area of high pressure. So if the city has this relationship with urban heat island at the observation point and all of that, surrounding areas with cooler minimum temperatures than that occurring in that same environment are going to have lower, different thresholds, essentially, because that data is incorporated into the climatology grid that's going into those thresholds as well. So we do observe, places like along the East Coast, Philadelphia up through New York, along the urban corridor there, the thresholds are different with higher minimum temperature thresholds than they would be in rural locations because of the urban heat island effect that's occurring along with climate change that's affecting, the climate record. So there's some of those local effects come through with that 2.5 kilometer climatology that we're using.
Got a question. Will the data have view filters similar to the National Weather Service Severe Weather Outlook region graphics by FEMA region, state, county warning area, etc., rather than just zoom scrolling?
Yeah, we're looking at the graphics generation process, and we're seeing what we can do. But yeah, doing it based on FEMA regions or something like that is probably the first step that we'll take as we start to populate the graphics tab on the page.
All right, we've actually had a couple of questions about this, and it's asking, are there plans to expand this to the U.S. islands and territories after testing it out within the CONUS?
Yeah, I would say that we are already in talks exploring how to do that, but due to some of what's already been mentioned of potentially lack of data, it is challenging. So we do hope to come up with some solution, but we don't have a timeline on that yet.
We have this was asked, but it wasn't clear on the answer. Is the 95th percentile based on the previous 5 years, 2019, 2023, or the climate normals, or both?
The 95th percentile is based on a fixed period of 1970 to 2020, so all stations are capturing the same heat events. In previous versions of HeatRisk, we're using the whole period of record, but what happens is different stations adjacent to each other experience different heat events, thus shifting the 95th percentile in different ways if they had that 1950s heat wave in there and then the next station didn't. So we decided to fix it to 1970 to 2020. So it's a 51-year period record. It's a long enough one, especially when you have the climate change fingerprint essentially causing the last 14 years, the last 10 years to be the warmest 10 years. You really start to get a lot of those dots up in the top 5%. So it really does, capture those events pretty well using that 50-year period.
All right, thanks for that answer, Mike. I think this one will go to Kim again here, and it's a request to repeat the end date of the public comment period. And they're also wondering, is this going to become fully supported once that public comment period is over, or will it still be considered experimental at that point?
So the answer to the first question is the public comment period is open through September 30th of this year, and what we do after that actually depends on what the comments are. We need time to evaluate, potentially make any adjustments. If there are very dramatic changes, we will probably need another public comment period to make sure that we are continuing to head in the right direction.
Thanks, Kim. This is a question that was answered earlier, but I wanted to comment. So someone asked, since mortality was used as a health outcome to base the heat alerts on, would this be protective for other outcomes like emergency department visits and hospitalizations? Rish, I wanted you to comment maybe again on the data used, why you use mortality and your access to injury information.
Sure. Thanks, Gail. I think the primary reason why we went with mortality data was, we wanted something that was available for every single county in the U.S. And we also had it from the National Vital Statistics System, which curates the data, and what we get is sufficiently QA/QC, so we could rely on that data. So, and we had data available for like 2001 through 2018 when we did this analysis. So we couldn't replicate, let's say maybe a emergency room visit data or hospital admission data for that long of a time period. So we had to rely on, something like mortality data to set up these relationships. But then, as Mike mentioned, like what we've been doing is we've been working with our public health partners and leveraging the data collected by the National Syndromic Surveillance Program on emergency room visits to, examine relationships, and then also look at, in addition to correlation, look at like sort of emergency room data did not go into the model or creating the heat health impact information. So how are we able to capture increases in emergency room visit data, again, like using these heat risk categories? So we've been doing that. So I think so far what we're seeing, as Mike mentioned, is we're getting very stable relationships for outcomes that weren't used in the creation of heat risk. So that's why, we went with the strategy of using the data for which we had a sufficiently long time period, like mortality data, and then trying to validate this with other health data sources as and when they become available. Mike, anything to add?
No, that was perfect.
All right, thanks for that answer, Rish. So this is an interesting one. It's asking, and I think Rish and Mike can handle this one again. In the observed heat risk loop, it sure seems like the extreme values are still most prevalent along the Gulf Coast, which one would think would be most acclimated to the heat. Is there a specific point at which it becomes so hot and prevalent that acclimation no longer matters?
I mean, it's hard because it depends on what adaptations or structural adaptations that population might have. So in the absence of something like AC, yeah, it's going to be difficult in anywhere. And then even in the presence of AC, if you have a sufficiently long heat wave, you still have to be outdoors at some point. So that's going to affect you. So it depends, a lot of in addition to heat exposure, the acclimation behavioral, physiological factors, as well as like any adaptations that place might have, will play a role in how people succumb to the effects of heat.
Yeah, and I'll just add, in 2023, it was a pretty unusual year in that the South experienced a lot of 95th percentile or greater dates. And this approach is identifying those as climatologically unusual, even for that climate. And that's the whole purpose of this, is that if you reached a lot of days of 95th percentile exceedant temperatures in Wisconsin, you'd see a lot of, orange and red categories being struck, up there over a given summer. Last summer, most of the exceptional heat was across the South, and so you're seeing a lot of that reflected in this animation that you're seeing here.
And if I could just add to that, last year the National Weather Service issued over 2,100 heat advisories and warnings, which the previous year was, I can't remember exact numbers, but only 1,000, so it was almost double the previous year in 2022. And then if you just look even further back in 2018, 2023 was about 3 times the amount of heat advisories and warnings that we normally issue. So last year was an unprecedented year.
Yeah, that was. Thank you, Kim. Another one, I think, Kim, this is probably a good one for you. Has CDC thought about the risks associated with combined events such as extreme heat and a power blackout? We've got a couple questions that have dealt with power outages and the increased risk that comes with that. I feel like that may be more of a weather service answer that needs to come. So what would you have to say about that?
So I would say that the relationships that our local offices have built with their partners, emergency managers, public health, et cetera, have led to some proactive measures when there are power outages from, for example, a landfalling hurricane, such as Hurricane Laura in 2020. The local forecast offices have banded together with local emergency managers, local officials, and public health officials to determine, hey, we need to lower our advisory criteria because their power outages are so widespread and this is going to be an issue. So the criteria for our watches, warnings, and advisories have been adjusted in those periods of power outages to help get the word out, and note that it's going to be a more dangerous situation since people are a lot more exposed than normal.
Yeah, and I'll just add to that, Kim, with heat risk, the orange category is for those folks that are at greater risk. If the power is out and a large population that normally have air conditioning no longer have air conditioning, that community has entered the at greater risk population, and at that level, the orange category of heat risk would be pretty beneficial in identifying the days that lower threshold would be appropriate for those folks as well. So heat risk also provides some guidance for the local offices when they work with their partners to identify those days from other less impactful days.
And I'll pass it over to Dr. Bernstein.
Thanks, Kim. Particularly around this issue of the combined events, and particularly a power outage combined with a heat event, I want to point out a couple of resources. One is launched today. So when we announced earlier today our guidance around heat that is attached to heat risk, there is specific information in that related to what to do in the event of a power outage, right? So the idea being that some individuals may have medicines that need refrigeration, some individuals may have medical devices that are electricity dependent, and we need plans in advance of a power outage that can hopefully get those folks either maintain their access to those devices or have an alternate plan. The other dashboard that comes from HHS that I would commend to you is called the Empower Map. It's the address I can maybe circulate in a chat or in follow-up, but it's Empower Program, EMPOWER program.hhs.gov. And this is a data set of Medicare beneficiaries. We've actually mapped where people who are reliant on devices that use electricity, so we can actually see where a power outage may be more impactful because people's lives are depending on it for medical devices. So this is a public health tool that we can use with HeatRisk. Say, boy, it's going to be a hot day. We have a high percentage of people in our jurisdiction who have devices that really require electricity. It doesn't specify necessarily down to the exact device, but it certainly gives a sense. And so that's another tool we can use in tandem. But we are very mindful about overlapping events. We're particularly mindful about wildfires and heat, because often when it is hot out, that is wildfire season. And again, our guidance does include information in our dashboard, which is cdc.gov/heatrisk. It includes heat risk, but it also has the air quality index, because even if as we said to our guidance, if it's getting cooler outside and we ask people to open up windows, we want to make sure that they're not opening our windows to bring in air that is potentially just as hazardous, if not more hazardous, than the temperatures were outside during the day.
Sorry.
All right, thank you for that answer. So this is another interesting question. It's asking, will there be a plan to relate heat risk and drought risk? Mike or Kim handle that?
Yeah, I can take that. As of right now, there's no plan to correlate the two. We do know that drought and extreme heat can have a positive feedback cycle. However, we also want to be cognizant of each individual hazard's impacts. Not to say that we won't look into it in the future. It's just saying that we don't have plans right now, and we don't want to perhaps wash out one or the other. We want to make sure that the message for both hazards are getting out. And we do that via what we call impact-based decision support services, the National Weather Service, again, working with those local core partners to message out the dangers and the hazards, both long-term, such as drought, and more immediate, such as extreme heat.
Thanks, Kim. So we have a question here, should be either for Mike or Kim. Someone asked if they've been using the Western Region Heat Risk Prototype page for a while, I guess, since it's been going on. They're asking, should we use the new URL that Kim shared? Can you comment on the Western Region, the legacy viewer?
So right now, while the heat risk is experimental over the CONUS, we plan to continue to run both, but eventually we will be transferring over to the URL that I shared in the chat earlier.
All right, thanks, Kim. And this one probably falls to you as well. And it's another good one. It's asking, is there a way to access the heat risk information in an offline mode if you have limited internet access?
Currently we don't, but that is exactly the type of feedback we're looking for. So thank you.
All right. Next one is also a data access kind of question. Or do you have or are planning to offer API or service connections that allow automated queries for specific locations and spatial temporal extents?
We are currently exploring that with our dissemination office.
Okay.
So again, we don't have an exact date, but we are in discussions.
All right, thanks, Kim. I haven't really seen too many other questions come in. Do you see anything, Gail, that stands out to you? Because I think we've pretty much
we've accessed it. Yeah, there are a lot of them that have we covered already. Data available, will this data be available in GIS platforms? The answer is yes there.
So does anybody else have any other questions that they'd like to chime in? Please feel free to put them into the question session here, and we'll go ahead and read them over. And if not, I'll hand it over to Kim again. Oh, wait, we got one right here. Okay, very good. Is there any plan to extrapolate the data for areas without population densities? For example, if a hunter is planning on a trip.
Yeah, so HeatRisk is available any place in the continental United States at 2.5 kilometer resolution. So there is HeatRisk data available everywhere. So you can just put in your zip code or your location, and it'll provide you with that forecast.
Okay, here's another one. Somebody's asking, what color do you recommend resilience centers open?
So I think that really it takes time for the resilience centers as well as emergency managers, municipalities, and weather service offices to evaluate this. I do know that some offices out west that have had heat risk longer have been able to analyze the data and base decisions off of it. However, it may differ depending on the population in that area. And Mike, I don't know if you have any other experiences from Western Region that you'd like to add.
Yeah, I think it's really down to communities exploring this and getting, more comfortable with the approach and how this framework, with this 5 colors, 5 numbers can work for them in terms of providing them with access to the right level that works for what they want to eventually accomplish.
Are there any plans to offer automatic daily emails with local heat risk information?
There's currently not any plans. That is something that we certainly could consider, but I think it would have to do a little bit more exploration on our resources. And also another thing that I think is important is we don't want any information that the Weather Service issues when there's hazardous conditions in the forecast. We don't want that to potentially be ignored because inboxes are overloading and there's just too much and people then miss important or vital data.
We have a question, how long forward are there currently forecasts available, and will the time frame forward be expanded in the future?
Right now, heat risk goes out a full 7 days. So you can go to the website and click through every single day in the forecast, as well as zooming into location and then getting a pop-up box if you click on the map, also showing those 7 days with the heat risk indicated at the day of the week indication or title. As far as intentions to expand beyond 7 days, that is something that we are looking into, but again, I think we want to make sure that heat risk, we first gather all the information and input and get it to the best state that we can before expanding.
All right, thanks, Kim. So this is a pretty good question, and this probably can go towards Mike or Rish as well. It's asking, do you have advice for to message to the public for a lower heat risk level? Obviously, I think they're thinking like level 1 or level 2. They say people can find it hard to know how to react when they are told that there is a small risk of death which persists for many days per year. So I can see where they're coming with that. It's like multiple days of minor or a lower risk, and how you would kind of message that.
Yeah, I mean, that's a great question. I'll start, and Mike, you can answer, and maybe Dr. Bernstein, you can chime in too. I think that's also the reason why, for the guidance that Dr. Bernstein mentioned, like we're looking at a much lower heat risk category. And also, in terms of taking action, like, yellow could be important too, depending on how sensitive you are to heat. So it doesn't mean that yellow is not going to affect people. There are individuals who might be impacted at a yellow level too. And actually, in terms of relating the number of days to sort of like the epidemiology of looking at the number of days of each category to sort of an impact, We haven't done that, and I think maybe moving forward we could look at, like, for example, like how many days of orange, how many days of yellow a given place has, and what would be the corresponding health impact for those days. That's something that we will be working on once we, move forward with launching the HeatRisk this season.
Do you have anything to add, Mike?
No, it's, yellow is a category that I think is surprisingly a low temperature threshold for those of us who have been messaging heat over time and that, but the data that we're looking at with regard to the emergency room visits, there are a number of emergency room visits that happen at the yellow level. I think messaging comes down to, the groups that you're trying to target with that messaging, who can take actions, to mitigate the effects of the heat at the level that you're messaging with versus, the people that are, that make decisions for other people, the people that, work in the health industry, making recommendations at these yellow levels. I think, every level, I think you have to know where you are in that at-risk population with regard to which level is appropriate for you, and then seek, good recommendations from a variety of sources, including probably the health field.
Do you want to add anything? Okay. Well, we are past time, so I just want to say thank you to everyone for attending and for all of your questions. The slides and recording will be available at the link I put in the chat. That's weather.gov/WRN/calendar. Take care, everyone. Thank you.